Okay, it's a great honor and pleasure to have with us here in this series of interviews about the people's responses to the COVID-19 pandemic. We have a representative from the self-administration in Rojava in the northeast of Syria, with all sorts of interesting things that have been happening the last several years with the Kurdish movement there. We have with us a representative from the movement by the name of Ghedir Sofie. She's a member of the Public Relations Council in the Health Department of the self-administration there. And like I say, it's an honor to have you to speak with us. So let me begin by asking a general question. What is the situation on the ground in Rojava in relation to the COVID-19 pandemic? And what are the fears and perspectives of the people there?
Well, primarily, thank you so much for you. Primarily, as positive cases, there are no positive cases now, but there were two cases recovered. They were a married couple, and they are now in good health. Well, in fact, there is a fear and anxious in society because the weak medical and economic capabilities. When I say weak in medical sector, I mean the laik of medical staff and the hospital are not equipped, and also the dispensaries destroyed due to the war. We can say that medical infrastructure is destroyed as a result for years of war, and also the medical and also the economic situation is destroyed.
Okay, and what have been the main initiatives that have been undertaken for responding to the pandemic?
Okay, among the most important measures taken are the closure of border crosses, the provision of quarantine centers, also the formation of rapid response teams, in addition, the imposition of a curfew inside and outside cities.
And at the grassroots level, how has the community been involved in these initiatives?
Well, the response of the communes as a smallest community organization is very good through the participation, interior security and health authority in improving the living needs of quarters that were put in quarantine.
And could you say that the people on the ground are enthusiastic about participating in these sorts of things, or is there fear? Is there just a little bit about that with respect to this kind of self administration?
Well, as I told you, the people, in fact, they live in fear situation, and they are really fear because most of people, they are fear from poverty, sir, and they fear from a weak medical situation.
So which have been the main organizations involved in coordinating the response to the crisis?
Well, among organizations that have contributed, the WHO, MSF, and the Italian organization UPP.
Okay, and has there been a presence of community health workers? And as you say, that some of there have been NGOs involved. And to what extent has the administration been working with NGOs in this response?
Yes, within the communes, as I told you, as a small community organization, there are health committees who playing an important role in educating people and introduce them to COVID-19 symptoms and the different ways that can um, spread can spread. Sorry.
Yeah, yeah. And what have been the main challenges you have faced in organizing this response?
Okay, as I've mentioned, reducing medical and economic potential in general, like of doctors, nurses, the like of medicine and necessary hospital equipment, and also the weak medical after years of war.
Mm, mm. And looking forward, what are the main prospects and challenges in continuing to respond to the pandemic that do you see?
Well, the two main problems are first the war and unsafe situation, and also in the economical part.
Mm. And in terms of international solidarity, what are ways that people can get involved to help? What are the main needs of the community going forward?
Well, the only cooperation that we can that a community can do is to apply medical advance and preventive measures. And in fact, the community in general are well aware of the dangerous situation and has been very understandable for the different uh, uh, producers.
Mm. And do you have any final thoughts about the lessons for or from democratic and federal principles that can be learned from the response to this pandemic?
Well, one of the most important lessons that a person um, re, pro, protects himself for himself and for society. The second is horizontal population expansion is in the service of facing COVID-19 because it reduces overpopulation in one region, unlike vertical expansion.
Mm. So yeah, I mean, any final thoughts you have in more generally about the situation in Rojava and things that we should know, those of us who've been following events there?
Yes, in fact, yes. My final word will be yes. My final words to human and humanity. COVID-19 is a threat to all human and humanity. However, here in this area, even the situation is more serious because here we are not facing just COVID-19. We are facing war. Has been yes, facing war has been going on for a decade, and also that. Economical situation is even more dangerous than COVID-19. I wish that humanitarian organization will allow and reopen the different humanitarian safe passes for medical and food for people in this area.
Yeah, thank you very much. Yeah, well, thank you for illuminating us about the situation on the ground in Rojava.
Thank
We
you so
hope,
much.
yeah, we hope the very best and to stay in touch. Thank you.
Yeah, sure. Thank you so much.
Yeah.